Well, a coronavirus model used by the White House now projects more than 200,000 Americans will die of COVID-19 by October 1st. That is up more than 30,000 from just last week. So far, more than 2.1 million cases have been confirmed here in the U.S., and more than 116,000 deaths have been linked to the disease. And now the CDC is giving us a better understanding of just who is getting infected. So we want to bring in Dr. Dyan Hes to talk a little bit more about that. Doctor, I want to talk about the CDC's new focus on who exactly is getting the disease. But right before we got on air, there was some breaking news about a new drug that is cheap and looks like it's a promising way to treat COVID-19 to reduce the number of people who die of the disease. Can you give us any more insight about that? I know it's just breaking, so we're just throwing it on you.
Well, yeah, I just saw the article about 5 minutes ago. So it's about using dexamethasone in patients who are critically ill. So there's nothing new about using steroids in lung disease. And I have to be honest, I know that in New York we've tried it. So it's usually actually the first go-to drug for any kind of lung illness. So I think it's about timing. It's about when did they try to use it. Maybe they need to try to start to use dexamethasone earlier. I haven't read the study, so I can't really comment on the study. Maybe we were waiting too long to use steroids in some of these patients. I'm not a hospitalist. I don't treat adults, but steroids are the first thing we use for asthmatics, for chronic lung disease. So it's not a surprise that it's working. I think it's all about timing. I think that's what's happening with a lot of these drugs. It's when do we start them?
All right, so let's get into the CDC's look at who's more vulnerable and who's most likely to get infected. What's the CDC saying? What have we learned?
Well, it's still really the same thing. We know that elderly are the most vulnerable, but now that we're testing, the general population, this virus has no boundaries. I can tell you that I have associates who are working in Florida where the numbers are going up, and one doctor reported that about 80% of the kids in her clinic had coronavirus. That doesn't mean they were all very sick, but they tested positive. So as we're going to test more people, we are going to see that it is going to, it's going to affect a lot of people. It's going to infect a lot of people, but it doesn't mean that a lot of people are going to have disease. So disease is when you're sick. So the problem is, are these families, of children who are positive going to give it to their parents, which so far the studies say no, because they're not super shedders like people were saying. Like they have it, but their cough isn't as strong. When they cough, they don't spray it into somebody else's face like an adult. So I just think, like, every week we go through this, but I think some of the data is so new that we just need time to see who's going to get sicker. I can tell you that the newborn babies who have it are doing fine. We really haven't had any critically ill infants that have been born with positive mothers or gotten it from positive mothers. It's only time will tell. These are all new studies.
Doctor, on Monday, the FDA revoked its emergency use authorization for hydroxychloroquine and chloroquine, a move that has been criticized by President Trump, who continues to sort of champion the drug as a treatment for coronavirus. What can you tell us about that?
So there's so the study was about treating coronavirus, not preventing coronavirus with hydroxychloroquine. So I'm actually in the camp that there are trials going. There are physicians who are actually in trials taking hydroxychloroquine, not every day, but every week, and sometimes even longer than every week, like every 2 or 3 weeks, to prevent catching coronavirus. So when Trump was taking hydroxychloroquine every day, there's no study that says that works, but there's no study that says it doesn't work. The half-life of hydroxychloroquine is about 23 days, so you don't really need to take it every day. And it's a very cheap drug, so if it could prevent somebody from getting ill, those studies are being done. But there are studies, and there are people who will tell you that the minute they got hydroxychloroquine, it doesn't have to be with Zithromax, and it doesn't have to be only in the elderly. In younger people, some people, and they will tell you, they swear the minute they got the hydroxychloroquine with either doxycycline or Zithromax, they're not patients who were critically ill in an ICU. Some of those patients have done better. So those are studies that's saying that, yes, in the patients who are critically ill with risk for arrhythmias is not the drug of choice. But I am still in the camp that it might work for people who are outpatients to prevent them from getting into the hospital, ending up in the hospital, and maybe with doxycycline, not with azithromax.
So we do know that, though, these are drugs that other people with other illnesses, I believe other autoimmune illnesses, depend on. There's a new study that was released that said prescriptions for these two drugs surged 2,000% as a result of, the hopefulness that it would be good at treating COVID-19. Can we talk a little bit about any concerns when you see, the demand for a drug skyrocket in that way?
Well, yeah, because it's hoarding, right? So people are getting prescriptions and they're stockpiling. I know that in New York, when that happened, it went from one day you can get hydroxychloroquine, then everybody who needed it for lupus or other autoimmune diseases could not get it. And luckily, we have other drugs that those patients can take, but those drugs really should be going to the patients who need it. But I do have to still say that hydroxychloroquine has been used for years and years. We give it to patients who go to, countries for malaria prophylaxis all the time, and they do fine with it. It's when we're using it in critically ill patients who already have underlying heart disease. Who ends up in the ICU? Mostly patients who have underlying heart disease, diabetes, other medical problems, the elderly. So it's not a dangerous drug per se, but you can't stockpile it, and take it away from the patients who do need it. That being said, I do not believe politicians should be regulating doctors' ability to write prescriptions.
So, Doctor, as we know, this pandemic has had an impact on all other aspects of healthcare. Because you're a pediatrician, I wanted to talk to you about this. We've been trying to get this question into you for a while. New York City has seen a significant drop in the number of child abuse reports. We are presuming that has a lot, it's 51%. We're presuming that has a lot to do with the fact that kids aren't in school, that these mandated reporters are actually, you're one of them, are physically not seeing the children. How concerning is that to you?
It's extremely concerning, and especially as parents become more and more stressed without income, food insecurity. Many children who are in the system already get 2 meals a day at schools. That's not happening. So if parents want to get meals for their children, and they have to go to the school and pick up the food and bring it home. When families are stressed, child abuse goes up, and also domestic abuse in general goes up. And as we are more, still in this phase 1 only in New York, we are very worried. Teachers are not seeing children, and pediatricians, nurses, school nurses. We're not seeing children. We're not seeing bruises. We're not seeing if they're coming to school, in dirty clothes. We're not seeing if they're not being fed. It's extremely worrisome.
All right, Dr. Dyan Hes, as always, thank you very much. And the last point that both you and Anne-Marie were making is so important to highlight, because COVID-19 is not just affecting people's physical health, it's affecting, obviously, the economy, and it affects children in school. And specifically with regards to this, these numbers and these statistics that we're seeing about reporting of child abuse, I mean, it just sort of highlights how this pandemic has sort of taken hold of all aspects of our society, and it's important that we highlight some of those aspects. So thank you, Doctor, as always.
Thank you for having me.